Hello everyone, welcome to my channel Daily Drug Info. And don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Linezolid, its classifications, indications, dose, strength, pregnancy status, adverse effects. Drug Linezolid classification oxazolidinones. Indications: vancomycin resistant enterococcal infection, complicated skin infections, uncomplicated skin infections, community acquired pneumonia, bacteremia, nosocomial pneumonia. Doses: vancomycin resistant enterococcal infection 600 mg q12 hours for 14 to 28 days. Complicated skin infections, uncomplicated skin infections, community acquired pneumonia, bacteremia, nosocomial pneumonia. Dosings are 600 mg q12 hours for 10 to 14 days. Strengths are available in injection formulation 200 mg per ml, 100 ml solutions and 300 ml infusions. Oral suspensions 100 mg or 5 ml. In tablet formulations 600 mg is available. Pregnancy status C. Adverse effects are diarrhea, headache, vomiting, dizziness, chest alteration, tongue discoloration, thrombocytopenia. Thank you.